Welcome to the AHRQ Data Tools website at datatools.ahrq.gov, your resource for healthcare data brought to you by the Agency for Healthcare Research and Quality. In this video, you will become more familiar with each of the AHRQ data tools. Before we get started, please keep in mind the data in this video are for demonstration purposes and might not be up to date. Let's start our tour by selecting the card for CAHPS, the Consumer Assessment of Healthcare Providers and Systems. This tool displays summarized CAHPS survey results. The results include the database averages for patient experience. Let's select the Health Plan Survey database card. The Overview tab covers basic questions about the CAHPS Health Plan Survey, along with a data table summarizing the responses. The second tab is titled the Top Box Results tab and reports the percentage of respondents reporting the most positive response. The Top Box Scores data table shows columns for composite measure/individual item, along with the database average percentiles. The third tab is titled the Percentiles tab and reports the distribution of top box scores. This data table displays columns for composite measure/individual item, with calculated percentiles at or below the lowest score, highest score, and various percentiles in between. Finally, the Bar Charts tab shows the distribution of scores in three proportions, which are grouped into never and sometimes, usually, and always. Let's select Data Tools Home on the top navigation menu to return to the Data Tools homepage and continue our tour by exploring the AHRQ tools. AHRQ stands for Healthcare Cost and Utilization Project, which is a collection of healthcare databases. Let's select the Deep Dive AHRQ Net card to go to the AHRQ Net homepage. The AHRQ Net homepage displays 4 selection cards, which allow you to explore data about inpatient stays, emergency department or ED visits, readmissions, and community-level inpatient statistics. Let's select the Inpatient Setting card. You can view data for a specific diagnosis, like diabetes, by selecting the Diagnosis and Procedures tab in the drop-down under National Inpatient. A line graph displays data based on the default filter settings. The data in AHRQ Net, as well as most of the other data tools, can be viewed as both trends or cross-sectional graphs. Under the Diagnosis/Procedures filter, unselect All to clear the default selections so that no diagnoses are selected. The graph and data table disappear. In general, if the display goes blank on any of the data tools visuals, you'll need to adjust your filters. Let's search for diabetes-related diagnoses. As you type the word diabetes into the search box, the filter drop-down displays all diagnoses that contain the word diabetes. Let's select 2 diabetes mellitus diagnoses options. The data table appears that displays data based on your selections. To update the line graph, select Diabetes options to include in the Diagnoses/Procedures to Graph filter. Now, let's explore AHRQ Fast Stats data. Instead of returning to the home page, let's select AHRQ Fast Stats from the top navigation menu. The AHRQ Fast Stats tool focuses on priority topics from AHRQ data and conveys complex information at a glance. The AHRQ Fast Stats homepage has 3 selection cards with data about state trends, national trends, and special emphasis topics like opioid use disorders or severe maternal morbidity. Let's select the State Trends in Hospital Utilization by Payer card to bring up a map of the United States, where you can select specific states on the map or use the drop-down to review data for that state. Let's select Arizona on the map to view the trend graph. You can also compare state trends side by side by selecting another state. For example, select California in the Compare to States filter. It will show the trend graphs of these 2 states side by side. You can view the trends data in a table by selecting Trend Table. You can get the data shown in the dashboard view by clicking the Download Data button below the tables. This option is available for all of the Data Tools dashboards. For the Fast Stats data tool, You can also download the complete data used to populate the FastStats tool. This is located further down the page. Let's continue the tour by reviewing the Medical Expenditure Panel Survey Household component. Select MEPS-HC from the top navigation menu. The MEPS-HC homepage displays 5 selection cards with data on healthcare use, expenditures and population characteristics, health insurance coverage, accessibility and quality of care, medical conditions, and prescribed drugs. Let's select the Medical Conditions card. The page displays a table that lists all medical conditions. Suppose we are interested in finding more information on diabetes. We can create a trend graph by selecting conditions from the table. Let's find conditions related to diabetes by typing into the Search by Medical Conditions search box and pressing Enter. The table changes to display records related to diabetes. When we select the diabetes mellitus record in the table, the graph changes to show an upward trend line of the number of people with care for diabetes. The MEPS-HC page also features the Variable Explorer tool, which you can find by scrolling further down the page. This tool allows you to view and search the variables across the MEPS public use files. Let's select the Annual/Main Public Use Files, PUFs radio button, and then select Go. The page changes to a view of a data table with search fields you can use to quickly search different variables across the MEPS public use files. Now, let's review the MEPS Insurance component or MEPS-IC tool. Select MEPS-IC from the top navigation menu. This tool has data about insurance offerings based on a survey of private employers and from state and local governments. The MEPS-IC cards group data tables by national, at a state level, and by metropolitan area in the private sector. There's a separate card for public sector data, and a civilian data card gives you information on private and public sector, as well as the local government sector's data. Each card has several selectable tabs grouped by category. Let's select the private sector state card and then select the Deductibles/Copayments/Coinsurance tab for a closer look. The default visual is a map of the United States showing data on employee deductibles. This particular visual shows estimates that are averaged over 3 years. Further down the page, you can find the data for the MEPS-IC dashboards in PDF tables under the MEPS-IC Complete Table Series section. The PDF links are organized by table series number and year. The final tool on the Data Tools site is the National Healthcare Quality Disparities Report tool. Select NHQDR from the top navigation menu. This tool provides data for improving healthcare quality and reducing disparities. Data are available at the national and state level. The Data Query card allows you to visualize state and national summarized data from over 30 different data sources. And the Special Emphasis card contains tools that highlight priority topics for the Department of Health and Human Services. We'll discuss the NHQDR data tools in more detail in separate videos, so be sure to watch those to learn more. This concludes our tour of the AHRQ data tools and their features. Visit datatools.ahrq.gov to find more videos about the AHRQ data tools and start exploring today.